A very warm welcome to you to Pune and to the Srimati Kashibai Navle Medical College and Hospital. It was a little warm a while ago, but I think it's all cooled down and nice and comfortable now. This is the third national conference of the AORA. We had the inauguration ceremony yesterday and live workshop for upper limb blocks yesterday, and we continued with the lower limb blocks today. We're now ready to begin the lecture sessions a little while later, which is going to run through tomorrow. Education is our passport to the future, and the future and tomorrow belongs to those people who prepare for it. So with the lecture topics that we've assembled for you all today and tomorrow, we hope that you will review your basics, strengthen your knowledge, and plan your anesthesia so that ultimately you have a satisfied and safe patient, a happy surgeon, and a satisfied you. We'll begin with the Dr. Ravindra Bhatt oration, which will be given by Dr. Vincent Chan. To begin the proceedings of the oration, I'll hand over the mic to Dr. Balavenkat.
Good morning to everyone. This morning, there's excellent scientific deliberations, started in a grand note with a live workshop. The next we move on to a very important part of the Academy of Regional Anesthesia of India. As most of you might know, we did the Academy of Regional Anesthesia, the second annual meeting at Ganga Medical Center and Hospital, Coimbatore, last year in the third week of April. Those who attended the conference, the feedback they gave indicated that it truly served its purpose. The organizing chairman for this conference was Dr. V. Ravindra Bhatt. Dr. Ravindra Bhatt has been working in Ganga Medical Center and Hospital since the year 1993. God bestowed him with many things. Very knowledgeable, very skillful, very dedicated, spends most of the time in the hospital, then at home. The commitment which he exhibited in patient care resulted in innumerable lives being saved, especially those who came with major polytrauma. As the hospital is designed as a trauma unit, by virtue of its being a tertiary care referral center in trauma, we used to get innumerable number of major polytrauma, most of them in the wee hours of the day. The night is as busy as the day. And we had a dedicated person in Dr. V. Ravindra Bhatt to convert the death into life. He started his innings in trauma care after he joined the institution in '93. But over a period of time, he developed enormous interest in regional anesthesia. This was somewhere in the year 96, 97, when regional anesthesia was not spoken much about in the global level. Because we also were a microvascular center and hand unit, he started developing keen interest in regional anesthetic techniques. Of course, it was more of paresthesia at that time, but he started it very earnestly, and he mastered the skill of administering regional anesthetic procedures, especially the upper extremity nerve blocks, with 100% perfection in most of the patients that he took care. So he continuously gave a dedicated service to patients who come with polytrauma. His perfection in regional anesthesia helped the patient the most because he conceived the concept of on-arrival block. When patients come into it's an industrial city, so we have plenty of industrial accidents. So people come with crushed, amputated limbs. So the protocol that we followed in our institution was, the minute the patient arrives into the casualty, we don't ask for anything. just the name, and we don't wait for the attenders or anything. Next minute that he arrives into the casualty, if it's a mutilated, amputated, crushed limb, the next minute the casualty or the emergency room is connected to the resuscitation room in the 4th floor, which has got an anteroom which is attached to the operation theatre, where the process of resuscitation starts, and not only that, immediately a block is instituted. So you make the patient who was writhing in pain to become pain-free on arrival, and then subsequently take him for investigations or examining the part. Everything happened after instituting the block. So this was conceived and practiced with remarkable consistency by Dr. Ravindra Bhatt, whether it was a day or night. So his dedication and commitment was overwhelming, and patients were so happy with the services that he rendered. For all those who would have seen him, you will never forget him for life. For all those who have interacted with him, it's a blessing, because he was able to rub on his enthusiasm to all of us. And for all those who saw him in the last meeting of 2012, Academy of Regional Anesthesia meeting at hospital, exactly 2 weeks after the conference got over, just on a similar day, that was a Saturday evening, when Dr. Ravindra Bhatt, after finishes the evening duty, decided to go to his native temple along with his family. He was walking on the platform of the Coimbatore railway station, and God thought that he has done enough to the world. And within a minute, as he was walking, he collapsed, couldn't be resuscitated or revived. He was a founder member of Academy of Regional Anesthesia of India, and his enormous contribution to the field of anesthesia has been extremely nicely exhibited by the thoughts of the plastic surgeon, our Chief of Plastic Surgery, Dr. Professor S. Raja Sabapathy, with whom he has been working since 1993. So Dr. Raj Sabapathy in his memoir wrote a small booklet to show how anesthesiologists can change the practice because of their dedication and commitment. And that book is there in all the bag that each one of you have received. I request all of you to take time to go through this, which is very inspiring. A note which has been submitted by the surgeon with whom an anesthesiologist was there. And I think this is one of the very rare occasions where a surgeon felt the vacuum so much. The surgeon was so moved so much that he decided to write a book in his memory. And the topic of the book, if you see in the cover page, he has written it as Game Changer in Trauma Care. So the minutes after the sad news reached the core committee of AORA, there was an unanimous decision taken within minutes after his departed soul. It was decided by all unanimously that this year AORA oration and the subsequent AORA oration be named after this great soul. So this is the first ever AORA Dr. V. Ravindra Bhatt Memorial Oration. It is indeed very unfortunate that we lost a great soul, but his work and his life would be a standing example for each one of us to follow and emulate, to make a difference to the patients who come to us. When we decided to have this oration, we thought the first oration to be delivered by a legend in this field of regional anesthesia, which would be a great tribute to Dr. Ravindra Bhatt. Hence, the decision was made, and I hand over the proceedings to the Academic Director of Academy of Regional Anesthesia of India, Dr. T.V.S. Gopal, who made the selection and who executed the process. I would also like to share Today we have amidst us Dr. Mrs. Chitra Bhatt and Dr. Ms. Kirtana Bhatt, the wife and the daughter of the great departed Dr. V. Rabindra Bhatt.
In the year 2011, a few like-minded anesthetists with a common passion for regional anesthesia converged to establish the Academy of Regional Anesthesia of India, with the stated aim being to learn, research and innovate regional anesthesia throughout India and empower us to benefit our patients through this service. In pursuit of achieving excellence through education, 2 national conferences were held in the past 2 years, and we have congregated in Pune for the 3rd Aura meet. Besides, several dedicated workshops and CMEs were organized across the nation under the aegis of the Aura. The growing realization that regional anesthesia confers clinical and economic benefits on our patients led to overwhelming patronage from the anesthetic fraternity, for which we remain eternally grateful. I have the onerous responsibility as Academic Director of Aura to introduce the esteemed speaker for the Aura oration, named after the late dear Dr. Rabindra Bhatt, a person whose memories will be cherished by us for all times to come. We are indeed fortunate to have amidst us Professor Vincent Chan, literally a towering figure in the field of regional anesthesia, to deliver this oration. I have had the proud privilege of knowing Professor Chan personally over the past few years. I wrote to him 2 weeks ago asking for his curriculum vitae, and he promptly responded. When I opened the document, I realized that it ran into 51 pages. Since there would be no further lectures this morning if I read the CV ad verbatim, I utilized all my skills to compress Professor Chan's innumerable achievements into about 3 minutes. Professor Vincent W.S. Chan, a Canadian citizen, is currently the head Regional Anesthesia and Pain Program, Toronto Western Hospital Network, University of Toronto. Among several honors and awards, he received the Carl Kohler Award from the American Society of Regional Anesthesia in 1998, was conferred the honorary FRCA by the Royal College of Anaesthetists, United Kingdom in 2011, was inducted as an honorary member of the Romanian Society of Anesthesia and Intensive Care in 2012, and received the International Anesthesia Research Society Teaching Recognition Award for Achievement in Education this year. He is the editor of Anesthesia and Analgesia and associate editor of Regional Anesthesia and Pain Medicine Journal currently. He was the editor of the RAPM Journal from 1999 to 2010 and the Canadian Journal of Anesthesia from 2000 to 2006. He is also an ad hoc journal reviewer of Anesthesiology, Anesthesia and Analgesia, Journal of Clinical Anesthesia, Clinical Journal of Pain, and Chest. Professor Chan has held important organizational positions in the American Society of Regional Anesthesia and Pain Medicine, culminating with his being the president of the ASRA over the past 2 years. He is the chair of the Education Track Subcommittee on Regional Anesthesia and Acute Pain, constituted by the American Society of Anesthesiologists. He is an organizer of the hugely popular and informative International Symposium of Ultrasound for Regional Anesthesia and Pain since 2006 and has been a member Scientific Program Committee of the World Congress of Regional Anesthesia and Pain Therapy. He has held numerous positions in the Canadian Anesthesiologists Society. Professor Chan handled several university and hospital committee assignments over the years in recognition of his administrative capabilities. He launched a pioneering website on regional anesthesia, usra.ca, a virtual treasure trove for the anesthetist seeking to expand his or her vistas. He's had a staggering 190 publications in international journals and has contributed chapters in 16 leading textbooks. He has 85 abstracts and presentations in international meetings to his credit. By his gracious participation, he lent substance at 160 symposia and workshops the world over and 91 meetings in Canada alone. His immense standing as a speaker can be gauged by the fact that the galleries are packed to the brim when he is at the lectern. Professor Chan readily accepted my invitation to participate as lead faculty in the 7th Advanced Regional Anesthesia and Ultrasound workshop conducted in Hyderabad last year. This is his second trip to India, and I pray that he enjoys the time he spends with us in Pune. And finally, in spite of his outstanding contribution to the specialty of regional anesthesia, he remains a simple, approachable, and affable person. Ladies and gentlemen, I present to you Professor Vincent Chan.
May I request Mrs. Dr. Chitra Bhatt and Ms. Dr. Kirtana to please join us.
Good morning, ladies and gentlemen.